everyone, welcome back to the No channel hosted by Danzile Dlamini. In this segment, we'll be talking about how we can protect ourselves from contacting the COVID-19. So stay tuned and don't forget to like this video. If it's your first time here, please subscribe and click on the notification bell so you don't miss out on anything that will be shared in this channel. Now coming to prevention, the main goal is to prevent human-to-human transmission. And in places where there's already an outbreak and there is community transmission whereby infection is happening between two people or within the whole community of people that didn't travel abroad or so, if you experience like the mild symptoms we talked about, you have to wear a mask, get yourself self-quarantine, don't travel, don't go anywhere to bars, to places that are like having a lot of gatherings, churches, and all of those places, and immediately call the hotline for that country. Maybe the people will come and get a specimen to check you, or you have to go there. It's different procedures for different countries. And if you're staying with a lot of people, you can ask to have a room alone and get yourself isolated there. Use your own mattress, use your own utensils, until it's proven that you are negative. And to those people that are high risk, like elderly, people with chronic diseases, they should also get themselves self-quarantined. Make sure you get all your medication, all your groceries that you need, and you stay indoor because you are high risk. You may get severe symptoms compared to the other people. Also, healthy people in those countries that already have outbreaks should follow the same precautions. Don't go to crowded gatherings, don't travel, because you may think that you are healthy since you be asymptomatic, yet you are already having the virus and it's still in its incubation stage. So most of the countries have issued rules of banning traveling, going to work, to school and everything. Please follow those rules. If you are a healthy person staying in a non-outbreak area, you should avoid traveling to outbreak areas, and you should avoid crowds, like going to events whereby a whole number of people, because you won't know who's already infected or who is not, and some people can be asymptomatic, like they're already in the incubation period, and in that way in events we get like closer to each other, and the droplets, they can try and find way to membranes and you get infected just like that. And we should also try to keep distance between each other, like more than like at least 2 meters, because we know that if the person is like 1 meter closer to you, it's possible they can cough to you when they're speaking. Those tiny droplets are coming to access your membrane and you get sick like that. Let's try to keep at least distance between each other. Like when we're in queues, let's try to keep that distance. And when we're in buses, it's kind of impossible that in the buses we can try to keep that distance, because in some buses people are like really packed. Like one person is facing the other way, the other one is facing the other way, and the space between people is just this much. So what we can do when we're going to buses or to public transport, we can try to put on masks. When it comes to masks, we know that they are designed for whatever I'm having not to go to someone else. So when I'm sick, I put on the mask so whatever particles I'm coughing, they don't come out. So that is very vital to already give. That is already vital to give masks to the people that are already sick, so they don't spread the infection to the other people. However, it's also important for people that are not yet sick to wear the mask on. Like for example, here in the buses or in other places, like the people, it gets like really crowded and people are just like up to here with each other. So it's important to put on the mask, so whenever someone is coughing the virus, it doesn't gain entry to you. Or maybe the person is in the asymptomatic stage and is not showing any symptoms and is within you and just talking, you can be prevented from the particles from coming through your membranes. However, we really have to use the masks appropriate. We know that the virus can stay on the fabric for up to 9 hours. So when you have the mask on, avoid busy adjusting it, putting it down when you're answering your phone, taking it up, because if the virus is already there, busy playing with the mask up and down, it can gain access to your membranes. And the mask is okay because if you put on the mask, you are also distracted to keep on touching your nose, your mouth, and your eyes. So it's very good when it comes to that. Also, when we are removing the mask, we have to make sure we remove it from the elastic part. We throw it away and we wash our hands under running water for 20 seconds to avoid contamination, because maybe the virus is already here for the whole day and you're just touching. Now you start touching your face. It was pointless to use that mask. And if you decide that, okay, I'm taking down the mask, I'm answering my phone, you better discard that mask and not we've already talked about this: cleaning of the surfaces, sanitizing the surfaces, the doorknobs, the keyboards, and everything. We already have some cleaning detergents from our homes that we use that have alcohol and those strong chemicals for destroying germs. Those are enough. We just use them for washing and cleaning the surfaces. And we've already talked about washing our hands under running water for 20 seconds. It's very important to wash under running water with soap. Soap is enough, not just water alone. So we have to wash on our palms, at the back, wash our thumbs, then wash like so, and remember to wash also this part, and then also rinse under running water, and dry yourself with a tissue paper that is going to be discarded later on. Then use that tissue paper to close the tap, and just throw it away. That is like very important. If you are like you are not really sure how to, if you have washed enough, you can just sing a song and just for 20 seconds you will be done, and that is very effective. And we've also talked about touching the T-zone area, touching our nose, our eyes, and the mouth. So we should really avoid that, because as we've said, this virus goes by droplets, and most of the time we touch surfaces and we come and touch our nose, our eyes, and most of the time it happens without us noticing. All of a sudden your eye is itchy, you have to touch it, and you haven't washed your hands or sanitized. And we have to avoid anything that can lead us to sharing of salivas or any droplets. Like we should avoid kissing, we should avoid shaking of hands, we should avoid sharing of drinks. Like I'm drinking, my friend is also drinking there, sharing of cigarettes, sharing of hookahs, and also the Holy Communion, the way it's given in church. Like sometimes some of the congregants have to share the cup, and when the pastor is giving out the bread, the pastor takes the bread, gives to this one congregant, takes another bread and gives to another without him washing his hands. That should be stopped, because he can transmit the infection from one congregant to another congregant. And also patching our books or whatsoever with saliva. We used to do like this and opening the books. That should be stopped, because the virus can stay there on the surface for till the next day, and someone else may come and contact it just like that. And also the most important thing, as we have said, that it goes by droplets. We should avoid the way we sneeze, cough, and maybe blow our nose. If we are coughing, we should use a tissue paper just once and discard it. We have a tendency of sneezing, folding it, keeping it in the pocket for later, again coming and using. That is not good, because we'll be touching the surfaces after sneezing and coming again. You just have to discard it at that time. And after sneezing, you make sure you have to wash your hands for 20 seconds after running water. And if you don't have the tissue paper, it's important to sneeze on your elbow or on your cloth, and make sure your nose and your mouth are covered in that process, so the particles don't fly away and they are only trapped on your clothes. And it will be vital to wash your clothes constantly, because if the virus was there, and it can be, it can stay in fabric for a long time. So we have to keep on washing our clothes, hanging it in the sun. Like if it's okay if the temperatures are like more than 30 degrees, because it can be killed by that, and it's safe for us. And there are so many rules we are given at the border gates or at the airports. It's very important to follow those rules. When you're coming back from whatever country, get isolated for at least 2 weeks, because at that time you can still be in incubation period and not be showing any symptoms. Don't decide that, oh, I'm not feeling sick now, I'm going to the shops. No, just stay indoors for 2 weeks until you see that you're okay, then leave that incubation period. And also in the border gates, when there are long queues, don't skip the lines because you are late, because you also skip the screening and you will go to your home and get your family exposed to the virus, yet you would have been screened and kept in quarantine and be well taken care of at that period. And there are some rumors, people saying garlic is curing the condition. That is not true. Garlic is it's high in vitamin C and it can boost your immunity. So taking immune boosters, those vitamin C, oranges, those garlic, it's okay to keep your immune boosted, so that when the condition comes, you don't get those severe symptoms because your immunity is low. You are able to stay in the range of getting those mild symptoms. And there are so many things also, people asking about money, what are we going to do with money? We're exchanging money between each other. We cannot sterilize money. I don't know if it's possible. Maybe there's a way to sterilize money, but what we have to do all the time is continue washing our hands for under running water for 20 seconds, and also using alcohol-based sanitizers. There are a lot of sanitizers they sell in the shops which don't have alcohol, or sometimes the content of the alcohol maybe is less than 60% or less than 90%. The one that is recommended, it's 90%, which I normally see in the shops, but in some countries they say if it's more than 60%, it's okay. So please make sure to always check the alcohol-based sanitizers, if the percentage, and also check if it really has alcohol. The other things that we've been hearing is that black people and children don't get the virus. Those are also fake news. Black people do get the virus. People have been saying this because maybe they haven't seen one, because maybe the virus at that time had not yet come to Africa. But there are cases of black people, and with children normally get mild symptoms, and it's very important for adults to always wash their hands, always prevent touching these T-zone areas, because children, we cannot tell our kids to always wash your hands, always don't touch your face. They just do it without, even if you tell them, they will always do that. So children get mild symptoms, yet they can come here with the condition and be having mild symptoms, and with staying with grandma, and grandma starts getting the condition. And we know that people that are at the age of over 60, they normally get the worst symptoms. So please, we should try from this period to at least try to make sure that our children don't get close to their grandmas or whatsoever. They do get the virus, but they normally experience mild symptoms. For all these preventive measures to be possible, we have to be honest. We have to change our behaviors, because we are used to touching our face, for example. We are used to shaking each other in a form of greeting. But right now, all of those things has to be cancelled, and we have to adopt new ways of greeting, the waving, hi, how are you, when the person is just there. It's fine. We have to be honest. And also, some people use informal border crossings, which are kind of illegal, and they go to other countries. When you come back here and you're like kind of feeling sick, and maybe in the hospital they ask you if you traveled or not, you have to be truthful and say you have traveled. I don't think the doctors will ask you what were you going to do if you're going to sell drugs or whatsoever. You have to be truthful and say I've traveled, and in that way you will be screened properly for the infection. So for us to be able to prevent the virus from spreading more and more, everyone has to play a role in the community. We all have to try means to stop it from spreading just by following these precautions, because in this way there are some people which are like their immunity is like already low. So if we are able to block the condition from entering our territories, those people are also covered. And there have been some questions that in the sub-Saharan region you have a lot of people that are like HIV positive.
If that person, the CD4 count is okay, the viral load is suppressed, and they're taking their ARVs properly, there's no need to panic. If they have it, they might have the mild symptoms like everyone else. And also, it's important to always follow the precautions everyone is following. But if you are not on treatment, or your adherence is not that good, your immunity is low, you might be in a position of experiencing the severe symptoms. So, and also we have unfortunate circumstances whereby there are refugees, there are people in the townships, in the squatter camps. You find that there are 7 people in one house, and if one person from that household get that infection, the whole township can be able to get. Everyone has a role to protect the community. We have to change our behaviors, although we are used to some of them, and also be faithful and be honest and follow all the precautions we are given. We have to protect ourselves by preventing touching the T-zone areas, putting on our mask when we're feeling sick. We go to healthcare workers. We have to protect our loved ones by staying in isolation until we finish the 14 days if we are staying in isolation for that period. Also, when we are not feeling well, we have to contact the healthcare workers, and we also have to protect the community. We don't have to go to crowds if we're not feeling well, and avoid just any crowds, just how our government officials have told us. And the other most important thing, we should avoid forwarding messages which are not authentic, which were not released by government officials, because this causes anxiety and fears while that information is not true. The healthcare workers and the government is always going to give us updates on what is going on, how many cases are there, how many deaths are there, and what is important for us to know. So we shouldn't forward those messages, and we shouldn't act on messages which are not authentic. We have to always listen the news, read our newspapers, listen to our radios for authentic messages. Thank you so much for watching, and if you have more questions, if you have suggestions, please drop down on the comment box below. And thank you so much for watching. Please like, subscribe, and share. See you next time.